So welcome back guys in a very fresh unit. In this particular unit, I'm gonna talk about the preventive obstetrics, preventive pediatrics and preventive geriatrics, right? So it's kind of a bigger unit, but I have divided that into some chapters as I have done with the previous units as well. So here we will be discussing first of all preventive obstetrics, then we will be discussing about the preventive pediatrics and so on, right? So this unit is very important for the exam point of view, guys. You can easily expect from around 7 to 10 questions in your MCQs, right? So 7 to 8 questions, 7 to 10 questions, that is the range which you can expect in your particular examinations, right? So in the very first one, in the preventive obstetrics or preventive in this particular unit, preventive obstetrics, pediatrics and geriatrics, I am taking the preventive obstetrics first. And in that case, I am starting with the MCH indicators. It means maternal and child healthcare indicators, right? So very important unit, and I will try to correlate it with your obs gynae and the pediatrics as well, right? We'll start with it. So if we talk about the MCH indicators, these are the maternal and child health indicators, right? So here we are talking about what indicators of maternal and child health care indicators, right? If you guys remember, some of the indicators I named them in the health determinants and indicators chapter when I was talking about the epidemiology and concept of health and disease, right? So you can go through that as well. Some of the indicators I have named over them, and here also we are going to talk about them. So MCH indicators, guys, here we are having some MCH indicators. These are two kinds of indicators we are using over here: maternal and child health care. It means the maternal indicator and the child indicator, child health indicators, right? So over here we can see some of the indicators. For an example, so commonly used mortality indicators are given below. For an example, we can see that maternal mortality rate, right? Maternal mortality rate, then mortality in the infant, the infant mortality rate, IMR, that is the infant mortality rate. Then the perinatal mortality rate, right? Perinatal mortality rate will be considering, that will be considering the stillbirth. I will be talking about that. What is stillbirth? That is the death after the 28 weeks of gestation. If the death is happening, that is called as the stillbirth, plus 7 days of life, right? So 7 days after the life, 7 days after the birth of the baby, right? So that is called as the perinatal mortality rate, and we will be talking about that, okay? Then neonatal mortality rate, okay, post-neonatal mortality rate, infant mortality rate, okay? Then we are seeing that 1 to 4 mortality rate, right? The age 1 to 4 mortality rate, under 5 mortality rate, child survival rate. So there are so many indicators over here. So we can see that we can actually divide these indicators into two types. One is the maternal indicator and another one is the child indicator. For example, if we talk about wherever the maternal is coming, that is the maternal mortality indicator. For example, you can see this one, maternal mortality rate, right? This is the maternal indicator. Others, most of the indicators will be the child related. For example, perinatal mortality rate could be the maternal, and the perinatal mortality rate, we are talking about the baby who is having the risk of death, right? Then the neonatal mortality rate, post-neonatal mortality rate, we are talking about the baby only, right? So these are the indicators which are very important over here. We'll talk about them, right? And we should know some of the important definitions, right? Which I'm sure you must have studied that in the pediatrics classes as well. What are these definitions, guys? Let's talk about them, right? On one side, I'm mentioning the period. On another side, I'm mentioning the duration, right? So what do I mean by that? Look. So very first one we are going to talk about, that is what is the neonatal period, right? Early neonatal period. Early neonatal period, right? What is the early neonatal period? You can answer. Then what is the late neonatal period? What is the duration between that day to that day? We are calling the early and late. You can tell me. Early neonatal period, late neonatal period. What is the neonatal period overall? Okay. Then what about the post-neonatal period? Post-neonatal period, right? Then what about the stillbirth? The perinatal mortality rate, right? The post-neonatal and the perinatal mortality. Perinatal mortality period, okay? Perinatal period, I can say, not the mortality. Perinatal period. right? So let's talk about them one by one, guys, right? Perinatal, what I told you, stillbirth, and the early neonatal period is called as the perinatal period, right? So over here, early neonatal period means from the birth to the 7 days of life, right? So from the birth to the 7 days of life, okay, that is termed as your early neonatal period, right? Very important for your pediatrics as well. Late neonatal period, guys, late neonatal period is from 7 days to the 28 days of life. 7 days to 28 days of life, right? 7 days to 28 days of life. What is the neonatal period? 28 days of life is the neonatal period. So total neonatal period, guys, is the 28 days, and we have divided this neonatal period into the two parts, early neonatal period and the late neonatal period. Early is having the, total neonatal period is the 28 days. Early one is having the 0 to 7 days, and 7 to 28 days will be the late neonatal period. So early neonatal period, late neonatal period will be forming the neonatal period. What about the post-neonatal? After the 28 days till the 1 year of life, that will be called as the post-neonatal period. So from the 28 days to 1 year of life, okay, that will be called as your post-neonatal period. Then the next one is the perinatal period. Perinatal period means there is a stillbirth. What is the perinatal? Stillbirth, birth after 28 days, we will talk about that, birth after 28 weeks of gestation, plus early neonatal period, that is the 7 days of life, from birth to 7 days of life. So I'm just writing 7 days of life, that is, or early neonatal period, okay, whatever you want. So over here, what is the perinatal period will be? That is from the perinatal period over here, that is from 28 weeks to 7 days of life, okay. So from 28 weeks of gestation, 28 weeks of gestation, right, to 7 days of life, right, so perinatal period is the 28 weeks of gestation to 7 days of life, okay. I hope everything is clear till now. So once again, guys, early neonatal period, late neonatal period, late neonatal period, then the neonatal period, right, 28 days. Then I have talked about the post neonatal period, that is after 28 days to the 1 year of life, and then perinatal period, that is the 28 weeks of gestation to the early neonatal period, that is 7 days of life. From 28 weeks of gestation to the 7 days of life, that is called as the perinatal period. Very, very important, guys. Any of these might appear directly in your MCQs, right? Either you can say this question is from pediatrics, either you can say this question is from PSM, right? Okay, guys. Now, as we have talked about several kind of indicators, we should be knowing the important formulas of these important indicators, right? For an example, what is the early neonatal mortality rate? Early neonatal mortality rate is having the formula, like, we know now what is the early neonatal period, late neonatal period, okay, perinatal period over here, we know about these things. So now we should be knowing about the mortalities over here, right, mortality rate over here, because sometimes these formulas are coming in your exams. So that's why I'm taking away. They're very, very important. MCQs are repeatedly asking from this topic. So early neonatal mortality rate, if I'm taking, right, what is the formula over here, guys? I'm telling you the trick. Here, in most of the cases, the multiplier which I'm using over here, that is 1000, right? And in the denominator, we are talking about the total live births. Out of the live birth, we are talking about this thing. So now it becomes very, very important. So now you just need to think about the numerator only, because in the denominator, we'll be seeing that there is live birth, right? Total number of live births. For example, early neonatal mortality rate. So you will be writing early neonatal death out of the total live birth, right? Multiplier will be 1000 only. So here we are seeing that early neonatal mortality rate will be having early neonatal death by total live birth into multiplied by 1000, right? What about the late neonatal period? We know that what is the late neonatal period? From 7 days of life to the 28 days of life, right? That was the late neonatal period, or 1 week to 28 days. So here what we are doing, basically a neonatal death minus the early neonatal death, right? I mean, this is the neonatal death, that is the 0 to 28 days, and this is the early 0 to 7 days. So if we want the late neonatal period, then what we need to do? Then simply what we need to do is that we need to remove from the neonatal period, if we will be removing the early part, if we will remove the early part, then it will be left with the late neonatal period. So that is the thing over here, neonatal death minus early neonatal death by total live birth multiplied by 1000, you can see. So that will be the thing over here. Here, I've just inserted the examples. For example, 500 divided by 30,000, just an example. For example, they will be giving you the data. In the MCQ, they will be giving you the data. Accordingly, you need to fill it, and you will be getting the answer, right? And we'll be talking about the per 1000 live birth, because we are talking about 1000 multiplier over here. Okay, so per 1000 live birth. Here also you can see 11.3 per 1000 live birth. That is example only. The data will be given in your MCQs. You need to fill that data, right? So main important thing is the formula over here, which you need to remember. What about the perinatal mortality rate? Perinatal, we know that what is the perinatal period now, right? From 28 weeks of gestation to the 7 days of life. So over here, stillbirth period will be calculating, and the early neonatal. Stillbirth, I told you 28 weeks, and early neonatal, I told you 7 days. So that's why we are writing that divided by total live birth multiplied by, I told you the multiplier, it will be 1000. So that's how you will be getting per 1000 live birth, right? Then what about the post-neonatal mortality rate? Again, you know that what is the post-neonatal mortality rate after 28 days to the 1 year of life. So number of death between 28 days and 1 year. So that will be the numerator, multiplier will remain 1000, and number of live birth will be the denominator. Same, right? So very easy. So even you just need to, you don't even need to remember these formula, because if you are having that particular thing in your mind that in the denominator we are having the total live births and multiplier will be 1000 over here. So you just need to put the numerator that what is they are asking. For example, post-neonatal period, so you will be putting the post-neonatal death in the numerator, right? So infant mortality rate, if we talk about infant mortality rate, means the number of deaths which are happening under 1 year of age. Infant mortality period, if I am saying infant mortality period, if I am saying that is the 1 year of age. So from the birth to the 1 year of age is called as the infant period, right? That is called as the infant basically. So infant mortality means the total number of deaths which are happening during first year of age, and the total number of live births multiplied by 1000, that will be called as the infant mortality rate over here, right? Now, two important things which might be confusing very easily, that MMR. MMR usually, if they are not mentioning anything, you should be taking it as maternal mortality ratio, right? Will not call that rate. But if the examiner is saying maternal mortality rate, MMR is maternal mortality rate, examiner is saying in itself in the MCQ, then you have to consider that MMR is the maternal mortality rate. Otherwise, generally speaking, that maternal MMR is the maternal mortality ratio, not the rate. So here, maternal mortality ratio, if we talk about maternal mortality ratio, maternal mortality rate, two formulas over here. So till now, what we were following the multiplier was the 1000. Here the multiplier will be 100,000, right? 1 lakh. And denominator, we were assuming that total number of live births. In the maternal mortality ratio, we are still considering the live births only. We are still considering the LBs, that is the live births. MDs are the maternal death over here. So still in the maternal mortality ratio formula, we will be considering the number of live births in the denominator. In the numerator, simply maternal mortality will be coming in 1 year of age, one year of time. So in 12 months, we are considering that. So number of maternal deaths which are happening in the 12 months or 1 year by total number of live births which happened in 1 year multiplied by 100,000, right? So here we'll be calculating that total number of maternal deaths happening per 100,000 population, right? For example, here we were saying per 1000 live birth. Here we'll be saying per 100,000 population, right? Okay, maternal mortality rate, if we talk about number of maternal deaths which are happening in 1 year, multiplier will be 100,000 only, but denominator will be not the live birth now. Denominator will be women reproductive age group. Okay, the denominator will be WRA, woman reproductive age, WRA, woman reproductive age group, that will be the denominator. And that is the important, crucial differentiating feature between the maternal mortality ratio and the maternal mortality rate. Maternal mortality ratio talks about the live birth. Out of the live birth, how many maternal deaths are happening. So ratio means numerator and denominator is not having the relation in between, right? We have talked about that in the screening chapter also, that ratio, rate, right? So in the ratio, rate and proportion, I told you. So ratio, basically the numerator and denominator is not having the similarities. I mean, numerator can be from any other unit and denominator can be from any other unit. For example, there is no relation between the maternal death and the children who are born, that is the live birth, right? But there is a difference between the number of maternal death and the women who are in the woman reproductive age group. So numerator, denominator, both of them are talking about the women only, right? But not in the ratio. In the rate they are talking about. So rate, numerator and denominator are related to each other, but in the ratio, numerator and denominator are not related to each other, right? I hope that was clear. So if you talk about the maternal mortality ratio, it will be number of maternal death by the live births. Out of live births multiplied by 100,000. Maternal mortality rate, number of maternal death in 1 year by Total number of women in women reproductive age group, that is 15 to 49 years. What is the age over here? 15 to 49 years. Usually that is the age of women reproductive age group. After 49 years, what happens? Menopause will be happening, right? So that is the thing, right? So once we are clear with these kind of formulas, now we shall be talking about some of the important definitions, right? So here, what kind of definitions we shall be talking about? So very first definition over here, which I am taking, that is what is fetus. Very simple definition, guys. What is fetus? Now I know that you must be talking about into the gynecology and in the pediatrics also. Fetus is very simple definition. Fetus basically it is a product of conception, right? After the intercourse, it is a product of conception, and it is showing the features of life. The product of conception which is showing the features of life, that is the basically fetus. So product of conception showing features of life, that is called as the fetus, right? In a technical definition, in medical definition, showing features of life, that is called as your fetus. Next we shall be talking about over here, what is stillbirth, right? Stillbirth, we know that what is stillbirth, we have talked about that 2 to 3 times over here till now, that stillbirth is simply, we are talking about, in the stillbirth we are talking about basically the 28 days, right? I mean the 28 weeks of gestation. So birth of fetus, that any kind of birth of fetus which is actually still, there is no sign of life basically. There is no crying, there is no respiration, there is no movement from the baby side, that is the stillbirth. So below 28 weeks, in India if I am talking about, right, below 28 weeks, probably we will not be able to save the life of the baby. If the baby is having some kind of problems, right, if the baby is actually, the baby delivers before 28 weeks, right, the baby delivers before 28 weeks, then probably will not be able to save the life of this baby in India, probably, if I am saying that, right, because we are not having that much advanced instruments and machines to save the life of the baby and, giving the life support to the baby at that point of time over there. In the US and all, obviously it can be from 22 weeks to 24 weeks. In the UK they are talking about 24, 26 weeks, and in the US they are talking about 22 weeks. It means that they can save the life of a baby if the baby delivers after 22 weeks of gestation. So that is the thing, but that is coming in the developed category I am talking about. But in the developing country like India, over here in India, what you need to remember is that below 28 weeks probably will not be able to save the life of the baby. So that is not called as a stillbirth. Stillbirth will be called as after 28 weeks of gestation. If any baby is born after the 28 weeks of gestation, right, that is called as the stillbirth. If the baby is not showing any kind of signs of life, right? What are the signs of life? For example, the baby should be crying, right? If you are seeing the delivery, right, after coming out of the womb, after coming out of the uterus of the mother, the baby starts crying basically. So as the baby delivers, the baby starts crying. The baby will be showing the movement. The baby will be showing the crying, the movement, and the respiratory movements might be seen over there, right? But if there is no sign of life, obviously the pediatrician will try to revive the baby. But usually if it is less than 28 weeks of gestation, then probably this baby will not be able to make it, right? And if it is after 28 weeks, then we are having some apparatus, right? So still the baby can be saved over there at that point of time, right? So if you talk about a stillbirth, guys, it is actually the any fetal death, and remember the weeks of gestation, 28 weeks of gestation, more than 28 weeks of gestation, or more than 35 centimeters of crown rump length, CRL. What is CRL? Crown rump length, okay, or more than 1000 grams body weight of the baby, or more than I will say more than 1 kg or more than 1000 grams weight of the baby, right? More than 1000 grams weight of the baby. So in those cases we will be talking about the stillbirth. So stillbirth, guys, once again, what is that? So what is the stillbirth? Any fetal death having more than 28 weeks of gestation, more than 1000 gram of body weight, or more than 35 centimeters of crown rump length, that will be considered as stillbirth, right? Now next over here, that is what is live birth, right? After stillbirth we shall be talking about the live birth. If we talk about the live birth, guys, the birth of the fetus that is showing the signs of life, right, that is probably the live birth, right? any birth, right, any baby which is showing the signs of the life after the birth, right? So I will be writing any fetus birth, any fetus showing features of life after birth, showing features of life after birth, that is called as your live birth, right? Next over here, which we shall talk about, that is neonatal death. What is neonatal death? Neonatal death means what I told you, neonatal period. Neonatal period, I told you that 0 to 28 days is called as a neonatal period. Early neonatal period was 0 to 7 days of life. I mean the birth to 7 days of life, and I told you about the late neonatal period, that was from 7 days of life to the 28 days of life. And if I'm talking about the neonatal death, any death which happens after the live birth. So if we talk about the definition over here, any death which happens after live birth, right? So that will be called as, or that will be considered as the neonatal death. Next we shall talk about over here, what is the maternal death. Maternal death, we are talking about when there is a death of the mother usually, right? Now there are several causes of the maternal death. We will talk about those kind of causes, but what is the maternal death in itself? Death of the female. If the death of the female happens, or if the death of the mother happens during the pregnancy, either during the pregnancy or due to the pregnancy related causes, right, or after the pregnancy till the 42 days of life, right? So what is the maternal death? Maternal death is death of female or the death of mother, right? Death of female during pregnancy or due to pregnancy related causes. Okay, that might also take the life of the mother. Pregnancy related causes, right? For an example, liver failure happens, or due to the cardiac failure, right, or due to the kidney failure, mother died, or due to any reason related to the pregnancy, right? If due to that the maternal death happens, or due to the severe anemia, because of that the mother died, right? Due to any kind of cause related to the pregnancy, if the mother is died, then it is called as the maternal death. So during the pregnancy or pregnancy related causes, or after the pregnancy till 42 days of life, right? Within 42 days of life, after birth of the baby, right? But please note over here, that we are not considering those deaths. For example, the female is pregnant, but unfortunately she met with some kind of accident, or she met with some kind of electric shock, or she met with some kind of trauma. If due to that pregnant mother is actually having the expiry, then in those cases we will not consider that as a maternal mortality, right? Because obviously the cause was different, right? So electric shock can take the life of any person, right? It doesn't matter pregnant lady or non-pregnant lady or any other human being, right? Accident, that is very unfortunate thing, right? It can take the life of any person, right? Doesn't matter. So there is no pregnancy related cause. If the death of the mother is happening, or death of the female is happening due to the pregnancy cause, then only we are calling that as maternal mortality or maternal death. Okay, so I am writing that electric shock or trauma or accident, right? I mean the physical causes, accident will not be considered the maternal death or maternal mortality, okay, maternal death or maternal mortality. Once you are clear with that, now we shall be moving on to some of the important causes of the different indicators. For example, what are the most important causes, or what are the most common causes for the infant mortality? What are the most common causes for the neonatal mortality? What are the most common causes for the for under 5 mortality? So these questions are sometimes coming in the exam, so that's why we should be talking about them. So very important thing over here. First, let me talk about the very first one, that is the infant mortality. We have already talked about their formula: infant mortality rate, neonatal mortality rate, perinatal mortality rate. We have already talked about them. Now I am coming to the most important causes. So for example, if we talk about infant mortality, right, What is infant? Infant means 0 to, I mean from birth to 1 year of age, that is the infant, right? We already talked about the formula of the infant mortality rate as well. So here, what is the most common cause, right? Most common cause, I'm writing the MCC over here, that is the most common cause. Most common cause for infant mortality, they are saying, right? Usually, previously they used to say it is prematurity, right? But now, right, now they are saying that this is not the prematurity now. Most common cause for the infant mortality, this is the hypoxia, right? So very, very important. This is what? This is the hypoxia. Okay, this is the hypoxia, right? After the hypoxia, right, either it could be the hypoxia, either it could be the birth asphyxia, or any other respiratory problem, right? Any other respiratory problems that might be leading to. But hypoxia is the most common cause which you need to remember, right? As far as infant mortality is concerned, right? If the question is coming, right, if the question will be coming about the infant mortality most common cause, then you will be marking that as hypoxia or the birth asphyxia, right? Okay, so that is clear. After that, slow fetal growth might take the life of the baby, then the malnutrition can be there, immaturity can be there, but these are the causes which are coming afterwards, right? After that, we shall be writing the slow fetal growth, right? Slow fetal growth, right? Or immature baby, there could be the immaturity, right? Or there could be the immaturity can be there, or there could be the malnutrition problem, due to that the baby died, right? But these are causes which are coming afterwards, right? But most common cause, that is the hypoxia. Second one is the neonatal mortality. Neonatal mortality, we know what is neonatal period. Neonatal period is 0 to 28 days. I mean from birth to 28 days. Neonatal mortality here, the cause will be same. Most common cause will be the hypoxia, right? And then you can write prematurity, but most common cause, please remember, that is hypoxia. Okay. Next, if we talk about the under 5 mortality rate, U5, I mean under 5, right? Let me write it completely. Under 5 mortality rate, I mean under 5 years, under 5 mortality rate, right? Over there we shall be writing the most common cause is the same, that is the hypoxia, and then you shall be writing the prematurity. So there also the hypoxia and the prematurity, right? But very first one is the hypoxia, then prematurity, right? So these 3 important questions you should be knowing. Okay, I'm telling you one more over here, that is about the mortality which is happening between 1 to 4 years mortality, and it is seen that in the age group of 1 to 4 years of mortality, it could be the infections which are infections and the sepsis which are coming on the top. So we are saying that septicemia, then the pneumonia, then the diarrhea. So that is the thing over here. So most common cause will be the septicemia, right? Then the respiratory pneumonia and then the diarrhea, right? So septicemia, infections, parasitic infections and all, right? They are responsible for causing the mortality in the 1 to 4 years of age group, right? Now, if you guys remember, I have talked about the maternal mortality ratio and the maternal mortality rate, right? We have talked about the differences between these two terms as well. Now, what are the most important causes for the maternal mortality? So most common, from the gynae side also it is very, very important. So for the maternal mortality, if I'm talking about what is the most common cause, maternal mortality, if I'm talking about, then most common cause, guys, most common cause. So as far as maternal mortality is concerned, the most common cause of death over here is the hemorrhage, right? It is the hemorrhage. And usually if I'm talking about the hemorrhage, right, that is PPH, postpartum hemorrhage. That is the risk in every every gynecologist mind or every obstetrician mind over there, that the female who is giving birth, right, after the birth of the baby, right, or during the birth of the baby or after the birth of the baby usually, and after the delivery of the placenta as well, what is the amount of blood loss which is happening? Because we are seeing that, I'm sure that you must have studied this in your obs-gynae classes as well, that the permissible blood loss levels, if you talk about in a normal vaginal delivery, that is 500 ml, right? So above 500 ml, if the blood loss is happening, the female might go first of all in the hemorrhagic shock or hypovolemic shock, or the female might be having that is called as a postpartum hemorrhage, PPH. And due to this PPH, a very important syndrome might be happening. Yes, that was Sheehan syndrome. I know you must have studied that in the obs-gynae. So, but Sheehan syndrome is not the part of this one. I'm just saying that maternal mortality, if we talk about, the hemorrhage is the most common cause of death of the females. So many of the females just die because of the huge amount of blood loss over there. We are calling that as blood loss which is happening after the birth of the baby. So that is called as the PPH, postpartum. After the birth of the baby, the mother is dying. So postpartum hemorrhage, right? Now PPH is the most common cause. Now PPH, if we talk about, that's the most common cause. So due to that, what happens? Why the PPH is happening? If you will be asking why the PPH is happening, PPH means postpartum hemorrhage. PPH is postpartum hemorrhage. After the birth, hemorrhage is happening. PPH. Why is the PPH is happening? Because of uterine atony, right? Because of uterine atony. Atony means there is no tone. A means absent. Tony means tone. Tone of what? Uterus. So uterus tone is absent. Actually, what happens is after the birth of the baby, the uterus will be undergoing the contraction. If the uterus will be unable to contract, then obviously the blood vessels, they will be continuing to leak the blood. If they will be continuing leaking the blood, so obviously the blood loss will be keep on happening as far as the mother is concerned or the female is concerned, right? So that's why it will be leading to the PPH over there. So that's why it's leading to the hemorrhage over there. So due to the hemorrhage, the mother might die. Right? So uterine atony is the most important cause over here, PPH, right? PPH might be seen. So I know you will be remembering that. Very, very important question, very, very simple one, when very frequently asked as well. Then if we talk about the other causes, other than that, what could be the causes which we shall see over here? So other than that, obviously the trained personnel, the trained obs-gynae doctor should be delivering the baby, right? And if we talk about the delivery of the baby, it should be clean and safe delivery, right? But over here, what could be the causes which can be the maternal mortality, which can lead to the maternal mortality over here, maternal death over here? The causes over here, which we shall mention, these are, the traumatic injury to the genitals, traumatic injury to the puerperium, or these things, right? Then the grand multipara, if there was multiple pregnancies, grand multipara, right? There was a delivery of twins, or there was delivery of more than 2 babies, that might lead to the very severe blood loss that might take the life of the mother. Then the prolonged labor, if the mother was having the labor for a very long period of time, right? So prolonged labor is not recommended if we are waiting for the normal vaginal delivery, and if she is not able to deliver the baby vaginally, then we need to keep one thing in mind, that this mother, if you will be waiting for so much period of time, first thing, the baby might be having the hypoxia, right? The baby might be having the hypoxia, and secondly, the mother might be having the risk of PPH, right? So in those cases, if the labor is getting prolonged, in those cases they are taking the patient to the OT, taking the mother to the OT, and delivering the baby through Caesarean section. So prolonged labor can be there. Then obstructed labor can also be the cause. Obstructed labor, right? Obstructed labor can also be the cause over there, right? Then obviously the severe anemia, malnourishment, severe anemia, then the malnourishment, right? All of these could be the causes, and there are many other causes also that might lead to the maternal mortality or maternal death. So very, very important thing. So here also we shall be seeing that if we talk about hemorrhage, right, that is the most common cause which we can see over here, 27%. So that is hemorrhage, which is the most common cause for for the maternal mortality, right? Other than that, there could be the sepsis, there could be the anemia over there, right? There could be the anemia, and then there could be the indirect causes also. Indirect and direct causes are there which are causing the death of the mother, right? Now, other than that, we shall be talking about some more important point over here. What is child death rate? Okay, what is child death rate, right? If we talk about the child death rate over here, this is the under 5 mortality rate minus the infant mortality rate, right? If I talk about one more, that is the child survival rate, or before that, I might be talking about the similar term, that is the child. I talked about child death rate. Now I'm saying child mortality rate. Child mortality rate. Child mortality rate is simply infant mortality rate, IMR. I'm just writing IMR, that is the infant mortality rate. So if under 5 mortality rate minus infant mortality rate, I'm saying that, then that will be called as the child death rate, right? Or I might be saying that the under 5 mortality rate minus child mortality rate is called as the child death rate. However, in English it seems same, right? But that is the difference as far as formulas are concerned, right, in this PSM. So over here, guys, what could be the formula which we shall talk about as far as child death rate is concerned? We should know the formula as well. So here, death of children, very simple, death of children 1 to 4 years. Why 1 to 4 years? Why 1 to 4 years? Because we are subtracting the infant mortality rate. Infant means period of 1 year, so we are subtracting that 1 year from the 5 years. So that's why under 1 to 4 years, right? Then death of children 1 to 4 years by total children 1 to 4 years of age. Total children having 1 to 4 years of age, and multiplier will be the 1000 over here, right? Multiplier will be the 1000. Secondly, if we talk about the child mortality rate, that is the infant mortality rate. Infant mortality rate formula you already know, right? So child mortality rate is actually the under 5 mortality rate, guys. Please correct that. Child mortality rate is the under 5 mortality rate. And if we talk about the formula of this one, that will be under 5 deaths divided by live births multiplied by 1000, right? That will be the child mortality rate. Next one is last one, that is the child survival index. That is child survival index. So what is the child survival index? That is called as the CSI. CSI, child survival index is 1000 minus under 5 mortality rate divided by 10. That is the child survival index, right? So in this particular topic, we have talked about the several indicators, where we have talked about the several important definitions. We have talked about the formulas of the important indicators over here. Then we had to talk about the periods, right? I mean, what is the neonatal period, what is the early neonatal, post-neonatal period, what is the perinatal mortality, and all of these things, and what are the causes of the maternal mortality, right? And what is the difference between the maternal mortality ratio and the rate, right? So thank you so much for watching this one. I'll be seeing you in the next one, right, where we will be discussing about the different aspects of the preventive obstetrics. Thank you.